Hello and welcome to MediByte. Today we're going to break down some of the most essential gynecologic tests and procedures, the things that are a really key part of your health journey. So let's get right into it.
We get it. These topics can feel, well, a little complex, maybe even intimidating. Our goal today is super simple, to give you a clear, straightforward guide. By the end of this, we hope you'll feel way more informed and confident about it all. All right, so here's our roadmap. We'll start with your routine well-woman visit. Then, we'll get into what a pelvic exam actually is. After that, we'll talk about crucial screenings like the PAP and HPV tests, dive into imaging and lab work, and finally, touch on some more advanced procedures.
First up, the routine well-woman visit. You should really think of this as the cornerstone of your preventive health care. It is so much more than just a quick appointment. It's your dedicated time to connect with your clinician.
So what does this visit actually involve? It's way more than just a physical exam. It's your one-on-one time each year for preventative screenings, sure, but also for personalized evaluation and counseling. It's a full check-in designed to keep you healthy.
You know, the absolute most important part of this visit is the conversation. It's a two-way street. You should feel comfortable talking about everything, from your period to your sexual health to any weird symptoms or just general lifestyle questions. The more open you are, the better.
Okay, let's move on to a key part of many well-woman visits, the pelvic exam. I know this can be the most nerve-wracking part for a lot of people, but understanding what's actually happening can make a world of difference. A pelvic exam usually breaks down into 3 simple steps. First, your doctor does an external visual check. Pretty simple. Second is the speculum exam. That's when a small instrument helps them get a clear view of your vagina and cervix. This is when they do a pap smear. And third is the bimanual exam, where they gently use their hands to check the size and position of your uterus and ovaries. And here is the single most important thing I want you to take away about this. Your comfort is the absolute top priority. The exam might feel a little weird or maybe slightly uncomfortable, but it should never, ever be painful. Please, speak up the second you feel any real pain. So why is that speculum exam so important anyway? Well, it's because it allows for some of the most critical screening tests we have for preventing cervical cancer. Early detection is everything.
Okay, let's clear something up that a lot of people get confused about: the PAP test versus the HPV test. A PAP test looks at the cells from your cervix to spot any abnormal changes. The HPV test, on the other hand, is specifically looking for the virus, the human papillomavirus that actually causes most of those changes. They're two different tools that give us a really complete picture.
So how often do you need these tests? Well, the guidelines have changed over the years. Generally, you start at age 21 with a PAP test every 3 years. Then, from 30 to 65, the best way to go is co-testing. That's getting both a PAP and HPV test every 5 years. And if your results have always been normal, you and your doctor might decide to stop screening after 65. But remember, these are just general guidelines.
Okay, so what happens if you're having symptoms like pelvic pain or weird bleeding, or if your doctor feels something unusual? That's when we move on to imaging and lab tests to get a much clearer picture of what's going on.
To investigate, your doctor might order a few different lab tests. A pregnancy test is often step 1. If there's been heavy bleeding, a complete blood count, or CBC, checks for things like anemia. And other blood or urine tests can help us look for hormonal imbalances or infections.
One of the most powerful tools in the toolbox is the transvaginal ultrasound. It sounds a little intimidating, but it just involves placing a small ultrasound probe inside the vagina. Because it's so close to the pelvic organs, it uses sound waves to create these incredibly clear, detailed images, way clearer than an ultrasound on top of your belly.
So, what can we find with this amazing imaging? It is fantastic for pinpointing the source of symptoms. It can spot things like ovarian cysts or uterine fibroids. It can also identify really serious issues like an ectopic pregnancy. It's often the key to finding the real reason behind unexplained pain or bleeding.
Now, sometimes, even after those initial tests, we need more specific information. This usually happens if an area looks abnormal, or if we need a tissue sample to know for sure what's going on. And this is where more advanced procedures come into play.
Let's walk through this. So let's say you have an abnormal pap test. The next step is often a colposcopy, which is basically using a special magnifying glass to get a closer look at the cervix. If anything looks suspicious, a small tissue sample, a biopsy, might be taken. For issues inside the uterus, like very heavy bleeding, a DNC might be used to remove tissue for diagnosis and treatment. And for tricky things like chronic pelvic pain, a minimally invasive surgery called laparoscopy lets a doctor look directly inside the pelvis to diagnose conditions like endometriosis.
So after all of that, from the routine visits to the advanced technology, what is the single most powerful tool you have for managing your own health?
It's your voice. The most critical tool in your healthcare is you. Being an active, honest participant, asking questions, reporting every little symptom, and speaking up if you're uncomfortable, that is what leads to the best possible care. It's that simple.
And that's our look at gynecologic tests and procedures. We really hope this has helped make everything a little bit clearer and left you feeling more empowered. Thanks so much for joining us.
If you found this guide helpful, please give it a like and maybe share it with someone you know. And for more simple, trusted health information, be sure to subscribe to MediByte. We'll see you next time.